If people are constantly gossiping about my situation and I allow it to disturb me, I will only be causing more problems for myself. Truth is, there's little I can do. I cannot farm on my own, so I rely on other people. If I am hungry, I go to them, and if there's something they can give me, they do. I'm just managing little by little until the time comes for my maker to call me, because I really cannot force anything.
The plight of a 79-year-old waiting to die. A painful mixture of abject poverty, a lack of information about the deadly pandemic, and living with obstetric fistula for more than 30 years. That is the story of Abongo Kunu. She resides at Pungu in the Kasina Nankana municipality of the Upper East region of Ghana. Abongo developed this medical condition when she was delivering her 7th and only surviving child. During the difficult and prolonged obstructed labor, which she endured without the support of timely medical treatment, Abongo started leaking urine, feces, and sometimes both. Every year, between 50,000 to 100,000 women worldwide are affected by obstetric fistula. The World Health Organization estimates that more than 2 million young women live with untreated obstetric fistula in Asia and sub-Saharan Africa. Obstetric fistula is also a major cause of maternal deaths. The magnitude of obstetric fistula in Ghana is unknown, and out of all the health facilities that provide delivery services, only 6% provide treatment and repair of fistula. That's according to a 2015 Ghana Health Service report on the incidence of obstetric fistula in Ghana. In 2014, Ghana constituted a national body, the Obstetric Fistula Task Team, with a mandate to develop a comprehensive strategy to address the problem in the country. Apart from advocating universal formal education of all children, especially the girl child, the 4 main components outlined in the strategic plan developed by the team to address obstetric fistula in Ghana are the prevention of the VVF through increased access to timely emergency, that is, emergency cesarean section, increasing the capacity of the health system to perform surgical repair of the VVFs, rehabilitation and reintegration of cured VVF patients into mainstream society. Abongo's life of misery is not over. She has never undergone any fistula surgery. This year, she was scheduled to undergo an operation to repair the fistula. Then COVID-19 struck. The government instituted lockdown measures and suspended all but necessary surgeries as it mobilized health facilities and personnel to address the COVID-19 situation. Elective surgeries like the one Abongo has been waiting for most of her adult life were suspended. Elective surgeries are those that are not a medical emergency. The repair of fistula falls under the category of elective surgery. For women like her, the decision by government at that time to suspend their surgeries at the beginning of the pandemic in Ghana is both a health and human rights issue. She sees no end to the life of ostracism, stigma and neglect that has shadowed her for the past 40 years.
Even in the presence of my family members, they say I stink of urine. So how much more when I attend public gatherings, especially funerals? People around will definitely look at me when I soil myself. My family even stares at me strangely because of my condition. People will always have something to say about me because of my situation. Unfortunately, there's nothing I can do to stop them from talking about me.
79-year-old Abongo Kono is not the only woman living with obstetric fistula here in Ghana. There are many women in Ghana whose plight have worsened due to delayed surgeries and other hospital care. 84-year-old Afarabadaga Atiru is a widow who lives in Pungu in the Upper East region of Ghana. Afarabadaga has been living with obstetric fistula for more than 4 decades. She curses the day COVID-19 emerged.
Sometimes I am tempted to believe COVID-19 is not real. I hear it is not real. And suddenly, it has also come to it is really real because I was hoping to get help for the fistula
She has lost all her 5 children. It was during her last birth that she developed the fistula, which has made her life a living hell. She ekes out a living, farming, even at her old age, and is not able to produce enough to feed herself.
I have a groundnut farm, but I have not been able to start cultivation on it because I feel weak. And to get laborers to work on it for me, I need money. So for now, anytime I feel fine, I try to work on the farm by uprooting the weeds. I don't have any relatives too who can help me. There's a white man here who sometimes helps the poor. It is from him I sometimes get money to buy food. Otherwise, there's no one to help me.
She depends on neighbors who sometimes give her food. Afarabadaga sleeps in a small room built for her by a good Samaritan. Her bed is the bare floor or bare wooden bench after her sleeping mat became tarted. She has never owned a mattress.
The clothes, you can see, there are only 2 clothes, this one and then. So this is how she sleeps in the night. Then when her ribs are paining her, she will put the mat on the floor. And you know the floor too is hard because it's not cement. So because the floor is hard and the dust, when she breathes, she breathes in the dust. So that, you know, the mat is weak. So when she lies, and there's nothing for her to put on top, like a blanket. She doesn't have a pillow or anything. No, right. So she just manages herself. She just manages herself. She cooks here. Even the charcoal, it's a problem. You can see the guitar voice. It's just the guitar school voice. Yeah, that's guitar school, and that's even the what they call it, the head. You can see.
She does everything on her own, from cooking to washing her clothes. Afarabadaga has never had the opportunity to undergo fistula surgery. Her only close opportunity was this year, and she was looking forward to it. According to the Ghana Health Service, even though this condition prevails in all the regions of Ghana, the northern region has the highest prevalence. Far off in the northern regions, Bandai, Nuuluga Balimbe, who is in her 50s, shares a grim story of attempted suicide. She has been leaking both feces and urine for over 20 years.
When I was affected by this medical condition, I was taken to so many places and given different types of treatments, but none worked for me. Now, it has even become worse. My neighbors and even my own children don't allow me to draw closer to them because they say I stink. Children make fun of me whenever they see me. Nobody eats my food. My own grandchildren are prevented from eating my food. Because of my situation, I think suicide is the best option to get me out of this misery.
She's never had the opportunity to undergo fistula surgery. Her close opportunity was in December 2019 when she was assessed and scheduled to undergo the surgery in 2020. But that was never meant to be because of Covid-19 and the imposition of restrictions in movement in March when Ghana recorded its first case on the 12th.
I was so excited when taken to the hospital because I knew I was going to be healed. I always tell my son to call you for me. But he complains of not having airtime, and I don't have a phone. I was told the reason you couldn't come for me was because of the virus.
She has been battered by poverty over the past years, and the COVID-19 pandemic has exacerbated her plight. Few minutes into my interview with her, Niwuluga started leaking. Rahinatu Isahaku is a senior nursing officer at the Buya Health Center in the Bandai district. She has been mobilizing women for fistula surgeries for more than 10 years. In December 2019, she was able to facilitate the transportation of Niwuluga and other fistula patients in the Bandai district for assessment at the Tamale Teaching Hospital in the northern region of Ghana.
It's a condition that they know themselves. So if they see that they are all suffering of the same condition and seeing one to be repaired, they try to find out how did you get the solution to your problem. Then that fellow is referred to come and see me. And if that fellow comes, I also try as much as possible to let them get a solution to their problems. It wasn't easy because the last time I sent them was when the Czech Republicans were coming to do some free surgery in Tamale. That was in December. So they all came with the help of one Mr. Edie. Sent them, we bused them to Tamale. And when they got to Tamale, they only assessed them and said they should come back and they will repair it after the new year. So I was preparing them to come for the surgery after the new year, only for this corona to pop in. Now it is said that apart from emergency, there's a cesarean section. They think fistula is not an emergency, so there's nothing done to them. So I personally visit them to reassure them and also get them the diapers and some detergents to be washing their things.
Rahinatu says she is inundated with calls for help from these women on a daily basis. At the heart of these calls is the question, when will they get the operation that will heal them just like other fistula survivors?
Actually, I said they wouldn't have confidence in me again, or they've been suffering this condition and thought I was the solution to their problem, only for them to be turned out and finally corona has come to pop in. So how soon, we really don't know. So even visiting them is always a challenge. They are becoming more worried and the stress is still in them. The depression is there and the stigmatization, you can see it yourself. They call to ask me how soon, when am I coming to send them to Tamale? Would it really work for them? That's what they always ask me.
Back in the Greater Accra region, 27-year-old Mansa, not her real name, is facing her worst nightmare, a complicated labor, abandoned to her fate by her two baby fathers and waiting to undergo surgery. COVID-19 has dealt her a big blow.
bra ye call honomono. Almost share not satam na corona na statia. But I'm saying I no more recorded 9 cases.
That be match.
Bacha. Inti ye buy no more share 1 week time. Say and sign bra. Ye call and say.
Ghana had recorded 9 cases of the virus at the time we first went to the hospital. So we were scheduled to return in a week's time. Eventually, when we went back, the cases had increased, and we also heard a lockdown was about to be imposed. We were then told to go and come back again in 2 weeks' time. Because of this, my hopes of getting repaired were dashed.
Because but now Capia or my year every one more because my friend Auntie Rose or say because of your reality.
Because I believe if not for the pandemic, I would have had my surgery and also lived a dignified life. Whenever I call Auntie Rose, she also tells me that I cannot have the surgery now because of the outbreak of the pandemic and the restrictions.
Sometimes she's had to adopt very unhealthy means of staying without leaking urine.
Me no so se me no so kese a e ba kese pa nti bi o ha me tumi tana the whole day so kra me no bi because me no so me tumi ko ni pe.
Anytime I drink a lot of water, I pass out a lot of urine uncontrollably. So I sometimes avoid drinking water the whole day because if I drink water, I can't go in the midst of people.
Because me dia so e ba kese.
Obstetric fistula has stripped her of her dignity as a woman. This feeling of worthlessness has driven her to try to take her own life before.
Sometimes because of study,
I sometimes think it's better to die because it will put an end to all this suffering. I remember some time ago, I went to buy rat poison to use. In fact, I wanted to kill myself.
The prevalence of the obstetric fistula highlights the inequalities that women and girls encounter in accessing reproductive health care. To cater for the cost of the surgeries, a special fund, the Obstetric Fistula Fund, was set up in 2018 at Access Bank to assist women and girls in need of medical treatment. Since then, a few individuals and organizations have contributed to the fund. Obstetrician, gynecologist and fistula surgeon at the Kolebu Teaching Hospital, Dr. Gabriel Ganyaglo, has been working with fistula patients for more than a decade. He is part of Ghana's Fistula Task Force team. Dr. Ganyaglo confirmed that the task force team carried out its last outreach in March at the Bole District Hospital.
Elective surgeries are cases that, as I've said before, can wait, and obstetric fistula falls under that category of surgeries that, though important to improve the quality of life of the patient, it's not a matter of life and death. And indeed, our statistics show that on average our patients have been leaking for about 4 to 6 years. So it doesn't fall under the category of cases that are a matter of life and death. So this has been the biggest impact of COVID on fistula repairs. This year in January we were in Mankasim and we did a number of cases there, and I followed it up to Saboba. We also did about 8 cases in Saboba. Mankasim we did about 12. Following on from Saboba, I was in Tamale Central Hospital where I did a lot of prolapse surgeries, and from Tamale I moved to Bole where I did some fistula repairs. I got back from Bole on the 12th of March, and I think on the 15th of March the lockdown was in effect, and it lasted for 3 weeks.
In the central region of Ghana, the majority of Ghana's fistula cases are handled at the Mercy Women's Catholic Hospital in Mankasim. Dr. Justice Osei is the medical director of the facility, where 80 fistula operations were conducted last year with the support from Access Bank, Ghana's First Lady Rebecca Akufo-Addo, and other philanthropists.
The amount involved in caring for these patients living with obstetric fistula is quite huge, and what NHIS provide is woefully inadequate. It's less than a tenth of what actually goes into the caring of such patients. And because most of them cannot afford it, we have taken it upon ourselves to normally solicit for funds to care for these women who are living with these terrible conditions. In 2019, most of our activities were funded by Access Bank. And then apart from that, we also had funds from Rebecca, the First Lady's Foundation.
Dr. Barnabas Nagandao is an obstetrician, gynecologist and fistula surgeon at the Tamale Teaching Hospital in the Northern Region. According to him, the hospital identified over 60 women who were scheduled to undergo surgery this year. These operations have also been suspended, and the women are waiting in limbo, not knowing when they will undergo surgery.
There was a team that has been planning to come and do mass surgery, and led by Wilder. So we had the enthusiasm that by the end of last year, 2019, we would have had all the statistics of cases that we could do in the first or latest second quarter of 2020. Unfortunately, as we were putting the place in order, because we have over 60 patients that are confirmed to be fistula and waiting. It is some of those that came at the very end of last year but could not be done. These were confirmed, and we still have a number of cases that reported upon hearing that over 60 patients had been booked for surgery in 2020, early 2020. They had also come and then yet to be assessed and then prepared for surgery.
Esinam Ahiadome is the Programs Officer for Governance and Health at Women in Law and Development in Africa, World of Ghana. Her organization has supported and promoted the cause of girls and women in Ghana since it was established in 1991. Last year, WorldAF, with the support from African Women Foundation from Spain, launched a project for fistula surgeries and awareness in the northern region of Ghana.
We are currently running a project being sponsored by African Women Foundation from Spain, and we are doing it in collaboration with UNFPA and Tamale Teaching Hospital to help women with fistula, to do the surgery for them and also create awareness on the situation. As we speak, there has been a hold on it.
She admits the project did not factor unforeseen challenges like the Covid-19 pandemic to put in place some relief packages for these women in the form of provision of sanitary items and stipend while they wait to undergo the surgery.
We didn't have any unforeseen, in case of, in fact, for COVID, nobody thought of it anyway. Yeah. We also didn't know that we were going to have this kind of interruptions here and there. So the idea is that we identify within a matter of a week or two, we are bringing them, and when they are fine, we feed them everything. When they are fine, we give them skills training, and that has been the whole thing. When the COVID came, we were personally, I have been trying to see if I will get some response, COVID response fund to these people, so that at least we get sanitary pad for them. Unfortunately, my sister, it has been difficult.
Still in the northern region of Ghana, the Yendi Municipal Hospital attends to cases from 10 districts. Dr. Ayuba Abdullahi is the medical director at this facility. He is also an obstetrician gynecologist and a fistula surgeon.
Okay, good.
He says the hospital carried out about 30 fistula surgeries in 2019 alone.
What we do is that we really don't book them per se and do, but as and when they come in, it's an open door. So it's all about advocacy, how the advocacy, the people will get to know that there is a surgeon here who can help them. So far, I think 2019, we do almost about 30 cases and that stuff.
Avongo Kunu Afara Badaga and other fistula patients dotted across the country are desperately waiting to have their surgeries so that they can be lifted out of their misery. For them, the surgery is a matter of living a life free from stigma and loneliness. But there is hope for Mansa now, as her prayers have been answered. She was part of the 10 fistula patients who had their surgeries at Mankasim in the latter part of August.
My margin said, never dinner master or my dinner, sorry, dining, sorry, demo. Now
that I am healed, I have resolved to go to church to share my story and also advise people with this condition to seek treatment. In fact, I am not shy to share my story in public because I know it would inspire others.
Here is Medical Director of Mercy Women's Catholic Hospital, Dr. Justice Osei, explaining how it was possible for Mansa and other few patients to have their surgeries at the facility.
So what this time around we decided to do was to operate on mainly those who have not had the surgeries before, like those the new cases.
For the other fistula patients on the waiting list, their fate no longer hangs on COVID-19 and the restrictions earlier placed on some surgeries, but the benevolence of individuals and organizations to fund the processes for their surgeries.
Nothing has changed much. The funding has been a very big challenge for us. This particular surgery, we had some organizations coming to help us. Sema Club decided to visit us and then promised to sponsor 10 patients, and actually they paid for repair of 10 patients.
For Afara Badaga, despite her helpless situation, she remains grateful and optimistic.
84-year-old Afara Badaga Atiru, singing her heart out, thanking God for bringing her this far. Despite the situation, she still remains positive and she is grateful to God.
For a condition that is almost entirely preventable, its persistence is a sign of global inequality and an indication that health systems are failing to protect the health and human rights of the poorest and most vulnerable, women and girls. For now, however, as the COVID-19 pandemic continues to ravage economies around the world and place a huge burden on health systems in Ghana, these fistula victims have to bear the brunt of the pandemic. The writer, Beryl Ernestina Richter, is a fellow of the African Women Journalism Project. This report is supported by the Africa Women Journalism Project in partnership with the International Center for Journalists, ICFJ.